All right, so today we have Hunter. He's coming in for a total knee replacement, and we're going to do some electrical stimulation on him. Some reasons that we would want to do electrical stimulation on a patient like him with a knee replacement would be because he has some pain and some muscle atrophy or strength deficits, and then also to kind of re-educate the nerves in the area that are going to the muscles to help them fire a little better. So those are some indications that we would use electrical stimulation for. Some reasons we might not use electrical stimulation would be if the patient has any active cancer, if they have an implanted device like a pacemaker, if there's any DVTs. Some regional contraindications would be if you're putting the e-stim on the abdomen of a patient that might be pregnant, or you wouldn't want to put them on the patient's neck to avoid having the e-stim get in the carotid bodies. And we also wouldn't want to do e-stim on a patient that has any cognitive or sensation issues.
Doctor, how's it going today?
Going good.
Good. My name's Thomas. I'm just going to be a student physical therapist working with you today.
Okay.
So we're just going to finish off treatment by doing some electrical stimulation. Have you ever heard of that before?
A little bit.
Okay. So basically the goal of this is to kind of get your muscles contracting a little better and to kind of help the nerves that are going to the muscles work a little better. So before we get started, I might just ask you a couple questions to make sure we're safe to do the treatment.
Okay.
So do you have any active cancer?
No.
Okay. Do you have any like sensation issues around your knee other than it being a little numb here and there?
Nope.
Okay. Do you have any DVTs?
No.
Okay. And then do you have a pacemaker or anything that might interfere with the electricity?
No.
Okay, perfect, sounds good. So what we're gonna do next, I'm gonna get the machine set up, and then I'm just gonna place some electrodes on your thighs, and we're just gonna hook it up to electricity and kind of turn the intensity up a little bit so we can kind of get a contraction. So I'll go ahead and set up. Okay, so we've got the machine right here. I'm gonna go ahead and turn it on. All right, and then I'm gonna hit the button for Russian. And then usually all the parameters should be set up already, but I'll go ahead and go through this to make sure they're right. So the pulse rate or the frequency, we want it to be about 50. And then the pulse width, we're gonna have it at about 10. And then right here's our duty cycle. We're gonna have that at 10 seconds on and 50 seconds off, because it's the patient's first time doing the e-stim. And we're also going to increase the ramp time just to make it a little more comfortable for the patient. And then while I'm applying the treatment, I'm going to push this button here to turn up the intensity. Alright, so I've got these pads here, and I'm just going to put them on your thighs.
Okay.
So I'll go ahead and do that right now. It might be a little cold, just a heads up.
Okay.
And then we want to put the pads on the motor points on the muscles so we can get the best contraction possible. Okay. Alright, so I'm going to turn the machine on, and I'm going to turn the intensity up a little bit, and when you start feeling kind of like a buzzing, tingling feeling, let me know.
Okay. Okay, starting to feel the
Little
tingle.
Okay, so I'm going to increase it a little bit more, and we're going for about 50% of a maximum voluntary contraction. So about as hard as you can contract your muscle, we're going for about half of that.
Okay.
So let me know when you get to about that point. Starting to contract a little there.
Yeah, a little bit.
Not too bad though, I can keep going up.
Yep.
Okay.
Okay, probably right about there.
Right about there?
Yep.
Okay, perfect. So while that's on, I want you to contract your muscles as much as you can. I'll have you kind of bring your knee to the back of the table.
Okay.
And then once it turns off, just relax, and when you start to feel it turn back on again, I'll have you do the same thing.
Okay.
And then for this video, we're only going to have him do about 2 contractions, but in an actual clinic, we'd have him do about 10 contractions. So this will just be a little shorter. Probably could have done 30 seconds. Starting to feel it again?
Mm-hmm.
Okay, good. Okay, good, relax. So I'll turn the machine off. And then I'll take these electrodes off. Alright, and his skin looks pretty good. There wasn't any cuts or burns before, and looks about the same after. So we'll call it a day, and we'll see you next time.
All right.